Welcome. Today's lesson is on what is palliative care and how does it differ from hospice care. When facing a serious illness, navigating the healthcare landscape can be overwhelming. It's crucial to understand the differences between palliative care and hospice care, two approaches that aim to improve the quality of life for patients and their families. With a fresh perspective on these types of care, we'll explore their unique benefits, how they compare, and how to choose the right approach for your loved one. In summary, palliative and hospice care both provide improved quality of life, support for families, and coordinated care. It's important to know the eligibility requirements and timing can help make the right decision for your loved one's care. And talking to healthcare providers and understanding the difference between palliative and hospice care helps choose the best option for you. Understanding palliative care. Palliative care is a specialized medical care for individuals with serious illnesses, focusing on enhancing their quality of life and providing relief from symptoms and stress. This type of care is all about addressing the physical, emotional, and spiritual needs of the patients, helping them make informed decisions about their medical treatment. But how does palliative care compare to hospice care, another option for those facing serious illness? Let's talk about who can benefit from palliative care. Palliative care is suitable for anyone with a serious illness, regardless of the stage of the disease, and can be provided alongside curative treatments. This means that patients receiving palliative care can still pursue aggressive treatments to combat their illness while benefiting from symptom management and enhanced quality of life. This approach sets it apart from hospice care, which is designed for patients with a life expectancy of 6 months or less. Let's talk about the palliative care team. The palliative care team is a group of healthcare professionals who come together to provide specialized care to individuals with serious illnesses. This team includes doctors, nurses, social workers, chaplains, and other trained specialists from a palliative care organization. They provide experts care for managing pain and other symptoms, discuss treatment options, and offer emotional support for the patient and family. And I also want to remind you that the palliative care team also includes the family caregiver and the patient. This is really important. The family caregiver is the key person to provide care for somebody receiving palliative care and will be included in the palliative care team as they're managing and working with the other team members. Hospice care, on the other hand, also offers similar support, but specifically, hospice care focuses on patients in the end of life stage through a well designed hospice program. So, where is palliative care provided? Palliative care can be offered in a variety of settings, such as hospitals, outpatient clinics, and even at home. The care is provided by a team of healthcare professionals who work with their patients and family and other providers to offer relief from physical, emotional, social, and spiritual pain. I see palliative care as the bridge to either hospice or to healing. And people need to see that as well and see palliative care as support for symptom management. So let's give you an overview of hospice care is a compassionate approach to end of life care, focusing on comfort and quality of life when curative treatments are no longer effective. Similar to palliative care, hospice care aims to provide relief from pain, fatigue, nausea, and stress that comes with a serious illness or the side effects of medical treatment. By utilizing hospice services and the hospice benefit, patients can receive the support they need during this difficult time. However, The hospice care approach is specifically tailored for hospice patients nearing the end of life. So, when is hospice care appropriate? Hospice care is suitable for patients with a life expectancy of 6 months or less, as determined by their doctor and the hospice medical director. This type of care is designed to prioritize comfort and quality of life for patients in their final months, providing emotional and practical support for both the patient and their family members. While some may resist hospice care due to feelings of giving up or losing hope, it's important to recognize that this compassionate approach offers patients and family members an opportunity for dignity and comfort in their final days. And I have to tell you, both palliative care and hospice care are underutilized benefits, especially hospice care. Doctors don't recommend it soon enough and they don't recommend it often enough. And I just want you to know, as a patient or a family caregiver, you can self refer to both palliative care and hospice care. So let's talk about the hospice care team. The hospice team, which provides hospice care, is made up of core members like doctors, nurses, and social workers, as well as any other specialists that might be needed. This team provides medical, emotional, and spiritual support for the patient and their family, ensuring that their needs are met throughout the end of life process. Hospice care teams, which include hospice providers, also offer respite care, giving family members a much needed break to rest and recharge. Respite care is one that we all need. It's offered very little, and it is offered under the hospice care team, which means that you're providing end of life care at home with the support of the hospice care team. And you need a break, a patient, your family member can go into hospice care in a nursing home where they will provide care. Or some places have units, hospice care units, or even hospice care homes, which are beautiful. And you have respite care offered through those services. Where is hospice care provided? Hospice care can be provided in various places, such as in the home, in hospitals, extended care facilities, or inpatient hospice centers, depending on what the patient needs and wants. Tailoring the care setting to this patient's preferences ensures that they receive the most comfortable and supportive care possible during their final days. Similar to palliative care, hospice care coverage depends on the patient's insurance plan, with Medicare, Medicaid, or private insurance often providing coverage for eligible patients. Medicare does provide care coverage for both palliative care and hospice care. So let's compare palliative care and hospice care. While both palliative and hospice care aim to improve the quality of life for patients with serious illnesses, there are differences in their goals, eligibility, and coverage. Palliative care focuses on managing symptoms and providing relief at any stage of illness, while hospice care prioritizes comfort and quality of life at the end of life when curative measures are no longer effective. Understanding these distinctions can help families make informed decisions about the best approach for their loved one's care. So let's talk about the goals of care. Palliative care focuses on managing symptoms and providing relief, aiming to enhance the quality of life for those with serious illnesses. This type of care addresses the physical, emotional, and spiritual needs of patients, as well as provides relief from the pain and other symptoms. In contrast, hospice care prioritizes comfort and quality of life at the end of life, ensuring that the patients receive the necessary support and care during their final days. So let's talk about eligibility and timing. Palliative care is available at any stage of illness, making it an option for patients dealing with wide range of serious illnesses such as heart failure, COPD, cancer, dementia, Parkinson's disease, and more. Hospice care, on the other hand, is specifically for patients with a life expectancy of 6 months or less, as determined by their doctor and a hospice medical director. Being aware of these eligibility criteria can help families make the right choice for their loved one's care. So let's talk about coverage and costs. Both palliative and hospice care may be covered by Medicare, Medicaid, or private insurance, with various levels of out of pocket expenses. While coverage for palliative care depends on the patient's insurance plan, hospice care is often covered by Medicare and other insurance companies for eligible patients. Understanding the potential costs and coverage options for each type of care can help family members make informed decisions about the best possible approach for their loved one's needs. The benefits of palliative and hospice care. Both palliative and hospice care provide improved quality of life, support for the families and the patients, and coordinated care for individuals suffering from serious illnesses. By addressing the physical, emotional, and spiritual needs of patients and their families, these types of care offer a holistic approach to managing the challenges of serious illness. So let's take a look at some of the specific benefits that each type of care offers. Improved quality of life. Palliative and hospice care, both focusing on managing pain, symptoms, and stress, leading to better overall being for patients. By providing medications, therapies, and other medical supplies, these types of care can help reduce discomfort and improve quality of life for patients and their families. This emphasis on symptom management and relief, as opposed to curative treatment, allows patients to maintain a higher level of comfort and functionality throughout their illness. I have had my personal experiences, I've had a family member both on palliative care and hospice. Palliative care has been used for me personally with my family to help symptom management, pain management, nausea, vomiting when being treated with cancer and chemo. And then later on, as we moved into hospice, the pain management and relief was so important. And I have to tell you, hospice, the social workers at hospice helped me so much when my dad was dying. I had a situation where my stepmother did not want me to be involved in the care. I couldn't even change a band aid on his head. And they came in and intervened with us because I'm the nurse. She had no medical care at all. And I just want to be there to support my dad and help him through his end of life. And I did. And I was there. And it was thanks to the social workers that helped us get over that hump, that obstacle, if you will, of the dysfunctional family. So I want to talk now about the benefits of support for families. This is really imperative. Both types of care provide emotional, practical, and spiritual support for patients' families, including bereavement care after the patient's death. This support helps families cope with the emotional challenges of caring for a loved one with a serious illness and provide them with the resources and guidance they need to make informed decisions about their loved one's care. Additionally, palliative and hospice care teams offer respite care, giving family caregivers a much needed break to rest and recharge. And I want to tell you that as many people as I've had that I've worked with that have had wonderful experiences with hospice, I've also worked with some that have had horrendous experiences with hospice. And I just want you to know you can fire a palliative care company or a hospice care company and have another one come in if you don't feel that they're meeting your needs. And I've had that personal experience and professional experience. I've had to fire hospice and replace it with another team. And it does happen and it's sad, but it does. Let's talk about the coordination of care. Palliative and hospice care teams work together with other healthcare providers to ensure seamless, comprehensive care for patients. The coordination of care includes making sure medications, treatments, and other services are appropriately managed to ensure the patient's needs are met. By working closely with other healthcare providers, palliative and hospice care teams can help patients receive the best possible care during their illness. So, how do you choose between palliative and hospice care? Discussing options with healthcare professionals, considering the patient's goals and preferences, and understanding the differences between palliative and hospice care can help families make informed decisions about the best approach for their loved one. By taking time to explore the unique benefits and eligibility criteria for each type of care, families can ensure that their loved one receives the most appropriate and supportive care during this illness. And I can tell you that doctors don't refer to these programs enough. They are really underutilized. If you want support during an illness, whether you're healing or heading towards hospice, you can self refer. Do your research, find a palliative care company in the area. Most are palliative care, and then they have a hospice care side. But don't hesitate to self refer and meet with their team and see what their criteria is and what they recommend. Of course, you can always with palliative care. And then as your symptoms start to decline, you can start hospice care. But hospice care and palliative care are just not utilized enough. Remember, palliative care focuses on symptom management and comfort, while hospice care is designed to improve the quality of life at the end of life. In conclusion, both palliative and hospice care offer comprehensive, compassionate approaches to managing serious illnesses and improving quality of life for patients and their families. By understanding the differences between these two types of care and working closely with healthcare professionals, families can make informed decisions about the best approach for their loved one's care. Ultimately, the choice between palliative and hospice care will depend on the patient's unique needs, goals, and preferences, but both options provide valuable support during challenging times. So now I'm going to discuss some frequently asked questions. Many always ask, so what's the difference between hospice and palliative care? Palliative care is available to all patients at any time during their illness and may include curative intent, while hospice care is reserved for terminally ill patients who have 6 months or less to live and does not include curative intent. Hospice care focuses on providing comfort and support to the patient and their family, rather than trying to cure the illness. It is designed to help the patient and their family cope with the physical, emotional, and spiritual aspects of the end of life. Is palliative care considered end of life care? Absolutely not. Palliative care is not the same as end of life care. It is a broader term that can last for longer and doesn't necessarily mean someone is close to dying. In fact, it is a bridge to healing for many patients. What are the three forms of palliative care? Palliative care comes in three main forms: physical, psychological, and spiritual. Each of them has its own unique role to play in the treatment plan. And can you give me some examples of palliative care? Palliative care is a form of treatment for many chronic illnesses such as cancer, heart failure, COPD, dementia, emphysema, and more. It focuses on symptom relief and helping families cope with difficult decisions as the illnesses progress, including providing support to caregivers. Additionally, palliative care can include treatments for anxiety and other symptoms related to the disease. And what's the meaning of hospices? Hospice is a special type of care that focuses on providing comfort, support, and dignity to people facing a terminal illness. It typically provides palliative care in a home like setting with the aim of maximizing the quality of life for the patient and the family at the end of life. The goal of hospice is to provide physical, emotional, and spiritual support to the family and their patient. It is a holistic approach to care that focuses on the patient's quality of life rather than the patient's quantity of life. I have to tell you the story about my dad. My dad was diagnosed with pancreatic cancer, and it was around the winter time. And every other year in January, he would go to Hawaii for 6 weeks. And he was a letter carrier. So he didn't have a lot of money, but he worked hard to have this. And he bought a timeshare in Hawaii. So when he was diagnosed, he had just had a Whipple procedure, which is a god awful, terrible procedure, but it did help alleviate his symptoms under palliative care. And it did help improve his quality of life for a while. And I'll never forget when my dad's sitting there in the hospital bed and told he's got 6 months or less to live, and they were going to put him on hospice. And my dad says, "Oh, I'm not going to get to go to Hawaii." And it was a few months away. But I said to my dad, I said, "Look, Dad," and this is a typical nurse response, "you're not dead yet. I'm sorry. And we don't know what you're going to feel in January when you want to go. So keep your plans. And if we have to, we'll put you on hospice in Hawaii." And that's what we did. And I could tell you, my dad went to Hawaii. They put him on hospice. While he was there, he had this, and it happens sometimes with people with hospice. They rally, they have this last rally. And so 2 days into hospice in Hawaii, and my dad's doing so well, they take him off hospice. He spent 6 weeks in Hawaii, and the day before he was to come home, he started not feeling well. So the hospice came in, they gave him some medications to help him travel. And he came home to Pittsburgh, Pennsylvania, where he died at home surrounded by his loved family. And it was just a wonderful experience for my dad to live out his life the way he wanted. And that's what I think about when I think about hospice care. It's having end of life on your terms. You decide what you want, when you want it, and how you want it until the very last breath. This lesson has been brought to you by Caregiver Relief. I'm Diane Carvo, RN.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.